In this video, we're going to be demonstrating single rescuer child CPR. Remember, the definition of a child is from the age of 1 up until puberty. After making sure that the scene is safe and you have your PPE on, you're going to approach the patient and assess for responsiveness. You're going to tap to check for responsiveness. If there's no response, you're going to check for pulse and breathing simultaneously. You're going to place 2 fingers on the carotid artery while looking at the chest to get the impression of whether they're breathing or not for at least 5 and no more than 10 seconds. After confirming that the patient is indeed in cardiac arrest, you'll have someone else call for help and get an AED. Expose the chest and immediately begin compressions using the heel of your dominant hand, placing it in the center of the chest. Being that it's a child, you're going to be using 1 hand instead of 2. Make sure to keep your elbow straight and shoulder directly above the point of compression. If you find it difficult to compress the chest adequately with 1 hand, you can place your second hand on top and use 2 hands just as you would with an adult. After performing 30 compressions, you're going to give 2 breaths. You'll place your pocket mask over the mouth and nose, sealing the mask, tilting the head all the way back, and each breath just over 1 second until you get chest rise. Immediately resume compressions. You're going to continue until the defibrillator arrives. Once the defibrillator arrives, you're going to apply the defibrillator using pediatric pads, which as you can see are smaller, placing 1 pad in the center of the chest and the other pad in the center of the back. Carefully roll them on their side. Make sure to connect the plug and follow the instructions of the defibrillator. Although the AHA does not recommend performing mouth-to-mouth ventilations on strangers, if it is a family member and you feel comfortable doing so, you certainly can perform mouth-to-mouth ventilations when you do not have a pocket mask. This technique that we're going to demonstrate now can be used for both children and adults. You're going to make sure you seal the patient's nose, tilt their head all the way back, and seal your mouth over the patient's mouth. Keep your peripheral vision on the chest so that you can see and assure that you're getting chest rise.